Thank you, everyone, and a very good evening and Happy New Year. Thank you for that kind introduction, Dr. Gooden, and thank you, Dr. Chung and Isaiah, for all the groundwork and helping coordinate this. And I really appreciate this invitation. It's good to see some familiar names on the screen. And for everyone, thank you for being here in spite of the late hour. There was this Verizon outage today. Some of you all might have been impacted. So my internet is a little unstable, and I'm going to share my slides. And in case you can't hear me well or you, there is any problem, please don't feel please go ahead and interrupt me. Also, since we are a small group, we can make this interactive and feel free to, just interrupt and ask a question or raise your hand. So, the focus of the talk today is really on co-creating safety, trust, and belonging. And I'm going to share a little bit about why I got interested in this and how I came to the realization that it is truly the power of connection, an authentic connection transforms us being as just individuals existing into a community. And a community to me is nothing else but a common unity. And it is belonging that transforms the community into one that is thriving. So, first, I have no financial disclosures. I have a lot of gratitude to many people who have helped me come to this realization and also who have walked alongside me in all times of joy and difficulties. A lot of my mentors are in these organizations listed here. I do have some leadership roles in these organizations. I'm a trained facilitator and coach, and I do some private coaching that I get paid for on the side. Most importantly, I'm not an expert in this topic that I'm going to speak about. However, I will glean from my own experiences and a lot of evidence that is already out there and combine the two and curate it and hope to share that today. So, as I've already talked about the objectives, I will also try to share some examples of how we've done that together in our own organization and also in some other collaborated with other organizations. So I'll start off by sharing a little bit about myself. Why did I get really involved and passionate about this belonging and community? So I'm originally from India, was born in central India. And when I was about 2 years old, I moved to London with my parents, who both physicians had gone there to do their post-graduation, my father in surgery and my mother in med peds. From there, we uh, came back and to India and settled on the west coast in Goa. This was a Portuguese colony just liberated about 4 or 5 years before we landed there from the Portuguese. And I grew up there all through school, middle school, high school, college, medical school in Mumbai University, and my first internship in Mumbai. Our home still is in Goa. So I was influenced a lot by the Portuguese culture as well as the Indian culture. After I graduated from my training and postgraduate training in India, I too moved to London to do obstetrics and gynecology and trained there um, and did an MRCOG and worked for a little bit, and then had the opportunity to actually go to Saudi Arabia and was there for about 3 years where my children were born. And we moved then to America. We had always thought about moving to America, but the Gulf War sort of preponed that. And we moved to Yonkers, New York, where my husband did his residency at Our Lady of Mercy. And since we had no social support system, I actually stayed home for 3 years, raising the children. Given that my husband was on a J-1 visa and we were dependents, we moved to Ray County, Dayton, Tennessee, a very rural county, 5 miles long. We were one of two Indian families and were there on a J-1 visa because it was a rural area. Then the only reason we moved there and not to another place that had been recommended was because University of Tennessee, Chattanooga was 50 miles away. And I knew I would eventually have to do a training to really, if we wanted to stay in America, both for the family reasons. So I did my residency in internal medicine at University of Tennessee, fellowship at UNC, and then stayed on in multiple roles. And here I am in Chattanooga. So, up till about a decade ago, people used to ask me, Dr. Panda, where are you from? And my initial answer used to be India, of course. But about for about a decade or so, I've started thinking about where am I from? More importantly, where do I belong? I've been immersed in so many cultures, and they have influenced me. But where am I actually from? So that's what sparked that. And then there was few incidents that happened in my life that really proved to me the power of authentic belonging. The first one was in Dayton, Tennessee. We moved into this home. This was the first home we ever had as a family. And I was really, really excited. And next to that house was a sort of, attached building here, which was empty that could be furnished. So I was very nervous moving into a new culture, did not know the people there. And about 2 months into our move there, we decided to invite my husband's colleagues for dinner. I was very nervous. What do I make? Indian cuisine, American cuisine. I practiced multiple times making sweet iced tea the southern way. Do I wear Indian clothes? Do I wear American clothes? How do I feel? How would I make the people that I'm inviting welcome? I really didn't know them very well. So I decided to go with the mixed cuisine. And of course, I had the iced tea. I wore Indian because I'm very comfortable in Indian outfit. So our kitchen was here with an island where I had laid all the food, and there was a window that overlooked this building. So I was very busy and engrossed in explaining the dishes to the guests when the wife of one of the senior colleagues who was facing out and looking outside the window asked me, Mukta, what is that building out there? And I said, oh, that's our outhouse. And I continued talking about the menu. The only thing I noticed then was the atmosphere in the room changed. There were almost snickering smiles between the women. Nobody asked me to go to the bathroom that evening, I realized later on. But I knew, and from then on, my nervousness and anxiety just continued to increase. That was an incident that happened very early on in Dayton. The second incident happened while I was an intern at the UT College of Medicine in Chattanooga. It was our first month, and I was on call with the chief resident. And he said, Panda, go down to the emergency room and see this patient. Apparently, I got a message saying he's about a 200-pound male who was brought in by the police. He's handcuffed, and he appears to be in rhabdo because he swallowed a rock. So I go down there and I see this rather large gentleman intubated, and his distraught mother sitting next to him with the police there, and he was handcuffed. Both the feet, the feet were in cuffs, and so were the hands. So of course I had to take the history only from the mother. So I kept, asking her, and sort of she was crying, and I went down the route of, does he have any psychiatric problem? Does he have iron deficiency? And why would this person be swallowing rocks? So the chief resident comes down about a few minutes later. He says, "Oh, Panda, what do you got here?" So I started, I'd practiced this history H and P. I needed to make a big impression, right? This was my first time I'm presenting. So he goes, "Yeah, so why do you think this patient is on in rhabdo?" I said, "I really don't know. He has no psych history. I'm not sure. Why would he be swallowing rocks?" And he just bent his head backward and laughed a big laugh. He said, "It's a rock of cocaine." So those were my two very early experiences. And these were some of my emotions that I went through. And I still have a visceral response when I think about it. What if that lady, the wife of my colleague, had been curious and asked me, Outhouse Mukta, tell me more. I'm not sure I understand. What do you mean about it, by that? Or if my chief resident had asked me, why were you interested in a psych history? Tell me more. Perhaps I would have been able to explain myself a little more and not have that same response. So it is our experiences that shape how we react because those experiences are influenced by culture. And it is that culture and community then that we are immersed in and that we experience that influence our sense of belonging. So those were my questions. So now I have really stopped asking, where am I from? I ask myself, where do I belong? So my journey was sort of that was my professional journey. I'm going to share a couple more examples. So I finished my residency and I was doing my fellowship. And just before I left for fellowship and I had a faculty appointment at the University of Tennessee, I was asked to, be on, and just to let you know, this program that I applied to only one residency, and they had told me that it's a very IMG unfriendly program. It's going to be difficult for you. And I said, look, I'm not going to leave my family. I, I know they're taking IMGs because it was a well-known thing that they needed them because they did not fill the year before. And I'm just going to put my head down, finish, graduate, and then leave. So as soon as I came to my second year, we had a new chair of medicine, and he really was different. He had come from Boston and was trying to change the culture. So, because of his influence, I stayed on as faculty. And I got invited to the promotions committee, the admissions committee, the pharmacy committee. I mean, I was in all these committees. And when I went to those committees, I realized I was the only one like me over there. And I was very excited and happy and felt, important initially. But after that, I was wondering, am I there just because I, fill a quota? And then while that was happening to me, my daughter, who was in middle school, had gone for a ball game with a friend who was white to a nearby school. And as they were leaving, this was at the same time of 9/11, a Jeep with some boys in it drove past and pointing to my daughter said, Traitor, go home. So she came back and we had to have these conversations. So those experiences made me realize it's not just where do I belong, but where do we belong? How do I show up for my family? How do I show up for people like me? How do I show up in the roles that I represent? Because there was something very important. While everything seemed so different and strange and anger and anxiety promoting, it felt like there's something wrong with me. But there was a part of me that also said, I need to find where I belong. And that sort of was the start of my journey. So I'll pivot now to what is belonging? Belonging is, by the Webster Dictionary, defined as a close, intimate relationship. And it really highlights the word close, intimate. And if you look at other definitions, the word authentic comes up many times. So I think those are the key words. And when you unpack what that really means, is that when you feel like you really belong, you don't just put on a mask or pretend to be somebody else and conform to things because you don't want to feel like you are the only person that is different. You feel comfortable showing up with all your strengths, your skills, your creativity, your curiosity, but also are not afraid to say, I don't know, I need help, or I made a mistake. That it creates a sense of safety. And only when we have this can we connect to our why. What is it? What do we feel is our purpose? What is it that we wrote in our personal statements? Why did we become healthcare professionals? What are our values and what gives us meaning and purpose? And this belonging is very different from fitting in. Fitting in was what I was doing when I was in London, when I was in other cultures, when I was in the first 2 years of my residency, seeing what others were doing, what were they saying, what were their norms, how were they dressing, and try to copy them. It almost was like I had an on-stage life and an off-stage life. And that is a that is a state of chronic stress and not sustainable. Because when you try to fit in, you sort of develop your own perceptions and assumptions. Many of those may be just your assumptions and they may not be true. And you're never your authentic self. And that leads to a loss of sense and self-worth. You become more and more critical of yourself. You either overcommit, like, yeah, I would want to be, valued. So you take on a lot of tasks that are not sustainable. You're internalizing a lot of high standards and always trying to prove yourself. And that's really a struggle. And you almost are going on this roller coaster of so many emotions. Whereas if you truly belong, then it really pivots everything, because belonging is very important. It's part of our core DNA. If you look at the Maslow's hierarchy of needs, it's one of the foundational needs. It takes precedence over self-esteem and self-actualization. It helps to develop our cognitive and emotional abilities in a positive way, promotes motivation, meaning, purpose, and moral alignment, increases the sense of personal and professional fulfillment. And that's only when we can become creative. And it sort of helps combat what the identity threat or the lack of inclusion may be. And we feel like we can show up and be ourselves. Prevents this feeling of wanting to be perfect all the time, and that self critical nature influences our overall well being. And when we feel we belong and we co-create this belonging, it enhances trust and teamwork and promotes the growth mindset. There are many
If I may,
yes.
I think you brought up in Dr. Gupta comments on how powerful this life experience is. And I think just what you're speaking about, you said you wanted to make it interactive. I think a lot of us it would resonate with, particularly women physicians, that feeling of belonging that we're trying to seek. And then when you mention things like overcommitting and making yourself available for everything because you think that by doing all these things you're going to prove that you should be there, right? And so you do all of that, and then ultimately you may not get the promotion or anything else. So then seeking those things don't exactly advance you in the way that you would think. And I don't know if it helps with the feeling of belonging either, especially when it's not rewarded with any positive outcome that you're expecting. You know?
Absolutely, it's a negative circle, downward spiral actually. And thank you for your comment, Dr. Gupta. I truly agree that, though our stories are unique, they have universal resonance and they are such powerful connectors. So yes, I totally concur with your chat statement. And thank you, Dr. Gooden. I was speaking about what are some of the barriers to this sense of belonging. It may be again, our culture that is experienced and observed. What have we been exposed to that we start normalizing, and the microaggressions, the biases, when we feel excluded. When we don't feel that we have emotional and psychological safety, we have this anticipatory anxiety all the time. When we are immersed in organizations or teams or have experiences that have unhealthy professional norms, just like you were saying, Dr. Gooden, when there is a lack of affirmation and a culture of devaluation or no support, our perceived or true strive for perfectionism, uh, again, this goes with the, not having enough affirmation or values. When there is misalignment of our values, when we are not, in alignment with what the policies and procedures where we work with the care that we have to give, and there feels to be a conflict with the oath that many of us take. The individual factors like personality issues and all are very minor. Those contribute very little. There are a lot of external factors that cause this barrier to belonging. And for some reason, my internet is slow again. Okay. So the important, I think I missed a slide. Let's see. Okay, so I think that's why it is important to understand that when we try to unpack belonging and try to co-create this belonging, it is important to look below the tip of the iceberg, because what people portray is just a tip of who they actually are. It's only when they feel safe and when there is a sense of belonging where I can speak up and I'm respected and accepted for who I am and what I bring, that we can deep understand the deep culture. And thus, not just the golden rule, but the platinum rule, right? Do unto others as they would like to have done, just like, I'm sorry, do unto others as they would like you to have you do unto them. So really reaching out and trying to understand what do they want, not to what do you want. So the key point of trying to unpack this value of belonging is it transforms the care that we give from one being transactional to being human centered. And these are AI generated images that I'd like to sort of give credit to. So belonging is the felt experience of being seen, valued, and safe, and that enhances team communication and shared decision making in healthcare, patient engagement, adherence, and outcomes, professional identity and moral resilience, compassionate, equitable, high quality care. It reduces harm and strengthens the psychological safety for every member of the team and the patient and their caregivers, and thus mitigates burnout, moral injury, and the imposter phenomena. And I have references at the end for all of these that I'll be sharing with Isaiah, so please feel free to share them with all. And then basically the outcome is you have safer care, care that is more human and more effective. So then how do we co-create this culture of belonging? How do we make this culture of belonging and connection the foundation as we are reinventing healthcare systems? So I think the first thing to remember is what I realized when I asked the question, do I belong here? Both are important, I and here. So the questions that we ask ourselves are, and we need to ask of our environment and ourselves when we are co-creating this, does anyone here even notice me? Are we visible? Are there people here we can connect to? Are there people here that value people like me? That is self value. These are the things that our body is automatically looking for. Is this a setting where I feel viscerally that I belong, even though I've been invited to the table and have a seat? Do I have a voice? And is that voice heard and affirmed? Or am I just a stereotype? And what have I seen and learned? Are people like me incompatible with this? Do I need to go to another table? So these are things that we are subconsciously asking. And if we really articulate them and ask those same questions as we are creating committees, as we are creating teams, then we would be intentional to co create this sense of belonging. So once we come with that foundation, this is sort of a framework that I have created the way I think of creating a culture of connection and belonging. It takes intrapersonal work, self work, interpersonal work, and organizational work to create this transformation. But it needs to be housed in a vessel of safety and trust. So let's talk a little bit about safety. So safety is a very foundational need to have physical, emotional safety, financial safety, but that feeling of say psychological and emotional safety is what I'm going to share now, in addition to, of course, other securities. And Amy Edmondson, if you have read her work, you'll realize she talks a lot about the importance of psychological safety actually in the healthcare environment and its impact on all our outcomes. So, a little bit about what happens, which you already know when we don't have safety. We go into our adrenergic response of fight, flight, freeze, fawn, and flop, and I'll go through those in a minute. And these by Stephen Porges has actually shown it leads to all these different emotions. If you look over here in the top two, freeze and flight. However, if we it's sort of the arousal keeps increasing the moment we don't feel safe. So fight is when we feel like we've been sort of wanting to change something, and yet we are continuing to advocate for change for our patients, for the system, and we are not heard. And when we sort of become a little argumentative, we may be mislabeled as a disruptive physician, or rather, if we have this safety, we can continue to have that fight instinct. We want to advocate, but we will do it in a way that we are standing up for a patient. It's a reframing, and that happens if we have a safe environment. Similarly, with flight, instead of just dissociating and distancing ourselves, we can actually pause, strategically rethink who are my cheerleaders here and how can I re engage. Freeze is really completely not being able to make choices, or unsure what to do, or self-doubting. And again, when there is safety, we have that chance to really reconnect with who we are, what we want to do. Fawn is when we over accommodate ourselves, say yes, overcommit. But here we can be open and be empathetic and say, okay, maybe we can do this differently, or why don't we think about doing this later on? I don't have the bandwidth right now. We feel comfortable saying that. And flop is really the worst of all, where we have an apathetic emotional shutdown. But this is when we can take a pause and say, look, I'm not well. I need time out. Because these adaptive behaviors only happen once we have this relational trust and safety and belonging. And when we have that relational trust, instead of going from the adrenergic response of fight, freeze, flee, fawn, and flop, we can flock together. We can come together with all our creativity, our skills, fortify ourselves with them, face together what we have to face, and flourish, create friendships. But more importantly, we find within ourselves to forgive ourselves and forgive each other. So when we have this safety, relational trust leading to belonging, that is what causes the transformative power and leads to all these positive outcomes that we are looking for. So how do we do this? What are some practical examples? I frame this in my book, Resilient Threads, as rituals, relationships, and reflections. And I'll go through these three themes individually. So the ritual is something that you do intentionally. It's different from a habit. Ritual is something that is connected to a greater purpose. And the first ritual is to have awareness of ourselves. Because if we want to have awareness of the other, to create this belonging and connection, we need to be aware of who we are. And the awareness that we don't have to change who we are, but how can we show up with our authentic selves? What is that self awareness and self care for ourselves? So the first self awareness starts by diagnosing ourselves. And I'm going to start with that means we replenish ourselves. So for me, my trigger to realize that I need to replenish myself and take a pause is I know when to halt. And for me, HALT stands for hungry, angry, lonely, and tired. I am not at my best. I am not I have a chance to not be kind and empathetic to myself or others if I'm hungry. I do get hangry. So I actually carry a bag with some crackers and small pieces of candy and granola bar, and I'm known as the candy doctor. And but it's an invitation for us, given our lives, we often don't have the time to eat. But so it, it's an invitation, but it also becomes a conversation starter many times. Angry. When I feel the hair in the back of my neck rising, or I feel myself, needing my hands, that's what I do, because I've been telling them that I've given a prior authorization 10 times and my patient does need this, or there are other reasons to take a pause and say, okay, how do I need to take a pause and reframe my motivation for this from anger to a different kind of action? When I feel lonely, when I'm at a table and I've been saying something and I don't even get an acknowledgement of it, or I feel lonely because, you know, there is something that was misinterpreted what I said. Again, a trigger for me to pause, think, okay, what really happened over here, unpack it before I take the next action. And tired is whether I'm physically tired, emotionally tired, or spiritually tired. I need to take a pause, because when we come from an empty place, we become very self-critical and we can't give to others, or we give to others from we give to others and don't give to ourselves. And then, as we are not at our best, we start questioning ourselves, and that starts a negative spiral of self criticism and imposter. So again, one needs to know their own triggers when they feel that they don't belong or they're not at their best, and then recognizing that in others. So remembering that who we are and how we show up influences the people around us, and this is known as health oriented leadership. There is data on it. So this attitudes are contagious. This one actually was in our morning report conference area. We had a poster of this in the faculty lounge, and there was a whiteboard by it. And when we started morning reports, or when we had a team huddle in our clinics, people would just walk in and they would write happy, sad, angry, I got cut off in traffic. I'm sad because my child is sick in the at home and I'm on call today. Or I'm sad because my daughter has her first ballet recital and I'm working. And while this was a cathartic thing for us, people around it were, laughing, joking, but there was a hand on the shoulder. Hey, why don't I cover you for the 2 hours while your daughter is at ballet? You can attend that. Or can I help you? Your son is sick. Maybe I can take your admissions today. Or, let me see your patients in clinic. We didn't have to ask. People were there. They saw each other and you felt seen and heard and you got the help. The other thing is choosing to be positive. I think there's enough data to, when we talk about awareness, there is always value in venting, but there is, after venting, how do we reframe that in something that is positive? So something that we did in our periodically in our faculty meetings was the 2-minute rant. I don't know if anybody has done that. It's an improvisation technique where we ask somebody to just have 2 minutes of unpacking whatever they were upset about, and the other person only had to listen without interrupting. And they switched. And then after that, the person who was listening has to reframe what they heard the other person say in a positive way. So, for example, we had one session where they said, I'm really fed up with the surgeons. They always dump patients on us. We always, getting all their chronic or whatever it is. And they kept on and on and on and on and that. And after that, the other faculty member said, I hear you, and I'm sorry this happens. However, what I hear is your passion for your patients, and you feel like they do not get the best care because of the delay or whatever that is. So again, it's a way of changing the mindset for yourself, always being choosing to be positive. Again, this is not being Pollyanna. There's a place for everything, but really trying to be intentional about finding meaning and hope while continuing to advocate and taking care of the issue. The other one is gratitude. So this we started in COVID. This is just a cheap cardboard paper with some Amazon sticky notes in the shape of leaves. We put them in the ICU and other places, and we just asked people to. I love that reframe. Thank you. My son and father are surgeons. I will tell them that. And we put this in the ICU. But gratitude has been shown multiple times to be the powerful, positive benefit for the person who offers gratitude and the person who receives it. Again, these are low hanging, cheap, easy opportunities to build connection. I'm sorry, my internet is very slow. Regulating your intentions. So, again, not to overcommit yourself, but also making sure you're not allowing others to overcommit or giving them a lot of tasks to do. And realizing, reframing. I've given you one idea of how to reframe in the positive. The other one is I always use this with the students, and others. Failure is just first attempt in learning. How do we learn from them? And you can read the others. My students and residents actually sent me this. They used to talk about FOMO, and when I was talking about reframing and it's okay to say no, they sent me this JOMO, the joy of missing out. I thought that was really nice. And this reframing, really helps us that if you want to, I love this quote by Don Campbell, if you want to make small changes, change the way you do things. If you want to make major changes, change the way you see things. And I think when we pause, when we take care of ourselves and others, we can really pause and reframe things. Restore is we all had hobbies and other interests before we went into medical profession. How do we find ways to bring that back? And I'll show you some examples later. Building connection. This is another low hanging fruit. We call it getting to know you bingo. It's a lot of fun. Just, put things together. It takes about 10 minutes. We do it with faculty, with interprofessional teams, nurses, residents, students, a lot of fun. And when we ask them, what is it that you want? What are your intentions you're holding for our time together, either in the clinic, as a team, or whatever? They all have the similar intentions, and it really brings that community. So really having them think about it and see they're coming from different parts of the world, they're coming from different lived experiences, but they all are here as a common unity. So really calling that out. Similarly, we asked them, what do you mean by belonging? And these were some of the words that came up, and I'm sure you all can resonate with that. This is how we do it, and we actually ask them to write their intentions and how they want to co-create belonging for themselves and others, and then we put them up as we build sort of a bridge with this, as a physical reminder that remains in perpetuity for the time that they are there in the clinics or and we keep adding to it. So, sort of visceral, low hanging fruit. So, the next one after rituals is relationships. Relational trust is built when one can speak both the head language and the heart language. And I love this quote by Parker Palmer. The other thing is, relational trust starts with belonging. And culture change that we want to see only happens at the speed of trust. So, building trust is very important. And I'm going to move on a little quicker here. So, how can we do that? Asking in whatever policies we make, procedures we do, how is culture and inclusion operating here in the who, the what, the when, and where? How are policies written? What are the norms? Are they written or unwritten? And how are we connecting to our value here? And one way we do that is we actually create these grounding principles. These are some that I give, and this is from my work as a coach and facilitator that I learned. But these are our grounding principles of our way of being together. Really calling out that we're going to listen with respect, knowing that it's not just expertise, but experiences that are important. All voices are welcome. Everybody is invited to participate. And most importantly, when we feel that things are hard and we feel ourselves getting defensive and judgmental, how do we turn to wonder and curiosity and ask the question, tell me more, rather than coming to judgments? and we actually come up with them for ourselves and then put them on a badge buddy, and then it sort of becomes a way we communicate. And it's also up on different places in different parts where we practice. So relational trust is important because it creates these safe and brave spaces. It co-creates community, communal, and really makes trauma a common experience. There's common grounds there, and then it leads to empathetic and ethical listening. So the other important part of this is to have leadership. And leadership, I put it with a small L because we all have the power to do this and we are all leaders. We influence the people in and around us. So how we created this work and how did we start? We started with very simple questions. We had cheerleaders in each of the areas that were going to bring professional understanding to strive for this community. And we said, what do you need to do your work? How can we make your work better? What about your work keeps you up? Just simple tell me more questions, and heard them and then empowered them to help us with the change. So it really goes back to this article published by Shanafelt and others: hear me, see me, get to know me, and show me you care. Coming to reflection now, I think reflection really connects us to our why, which really gives us meaning and purpose. And when we have a reflection in community, it increases this connection and belonging. So, how do we connect? How do we create this reflection? Um, what we did was once a week in the clinic huddles or with the learners or with faculty, just took a few minutes to ask, what about our work together gave us hope? What surprised us? What inspired us? And as we started unpacking, we realized we had similar experiences, but it gave us a way to, again, connect with what we were feeling, even if it was not with meaning and purpose. We helped each other understand perhaps there was meaning and purpose in that, and it built that community. Then, instead of just asking how are you, perhaps starting with a icebreaker or something that is quick, that said a success story is what we do in our meetings. Are there any success stories that one would like to share? And we respect each other's time because that is part of our grounding principles. This check-in I've already shared. The other one is a buddy check that we borrowed from the military literature, where we send a buddy check, and this is an example of one that I send every weekend. I send to about 25 people. It's paid forward, and I've been told there are quite a few hundred on it now. So again, just making sure that we're reaching out to people. Don't expect a response, but just knowing that we care. We do reflection in community with for our students. It's called the How to Live curriculum. We have gratitude rounds, and then for the residents, it's called Relaxing, Rejoicing, and Rejuvenating in Residency. This work I did at UT, and we are just starting it at Morehouse now. And this sort of also is embedded in our cultural humility work that we do in the foundations of that, which is the mnemonic of humble. It requires us to be humble, where we honor others' beliefs, customs, and values, understanding our own biases, and ongoing self-reflection and critique, maintaining respect for people from all cultures, knowing that we will never be an expert and should not be an expert, always coming from a place of tell me more and learning with compassion and kindness, and engaging and advocating to co-create this. And it's really a call for action. This is another uh, um, tool that I found on the internet, which is Assess. So, what about AI? How does AI fit into all this with co-creation? Is it something that we have to be mindful of? Because our traditional model was face-to-face interactions, community involvement, and now we see these sort of cartoons both in the clinical and academic world. I think we are here as healthcare professionals to speak both the head and heart language. Before it was us and the patient. Now we have a third person. We have the AI with us, technology, and we need to not forget that belonging humanity is important, and we have to continue to speak that head and heart language. So how do we do this? What is the intersection of touch and tech? AI does exceptionally well by executing patterns, optimizing efficiency and consistency. And we should not compete with them because we will not be able to do that. But we are about healing. We are about holding that space, that silence when we don't have the answers. We have the power of clinical reasoning and a deeper realization that AI doesn't have. So while the role of artificial intelligence is there, humans do something much more. We have empathy and emotional intelligence. We have a presence that is felt, that is not just an algorithmic um, computation. We can inspire and give hope with creativity and imagination. And true reasoning is fundamentally a human domain. So for us, we really have to preserve this because what we do is we feel with our senses, we feel with our, excuse me, we understand with our senses and we act with our spirit. It's only then that we can have the human touch, and no machine can replicate that. So it is that human touch and technology that really need to work together. And human touch cannot replace, I mean, sorry, technology cannot replace that human touch. So, this is a quote that I really love. We are not human beings having a spiritual experience. Perhaps we should think we are spiritual beings having a human experience and move from artificial intelligence alone to really authentic interactions. And this is a concept that we have in India, which is called Vasudev Kutumbakam, which means the whole world is your family. And to have that human connection means we treat every human being with a deep respect. And in India, we say namaste, which really means the spirit in me acknowledges and respects the spirit in you.